Hi, I'm Dr. Jessica Moran-Hansen. I'm one of the ear, nose, and throat doctors here at ENT Consultants. We are going to be talking today about tonsillectomies. So the most common indication that we take tonsils out now in children, so that would be kids under the age of 18, is actually for something called obstructive sleep apnea. So what's obstructive sleep apnea? That's when kids actually have pauses in their breathing at night and stop breathing, usually due to obstructions from the tonsils and the adenoids. How do we diagnose this? Sometimes it's just based off of the symptoms that you come in and tell me about. So if you tell me that your kid is a snorer constantly, a restless sleeper, has a lot of mouth breathing, still wets the bed even though they're a little bit older, those are all signs and symptoms of possible sleep apnea. Sleep apnea itself is when they're usually snoring and then they have this period of kind of pausing in the snoring and breathing, where sometimes you can see their belly still moving like they're trying to breathe through that obstruction and they can't. Those are all very normal signs and symptoms of sleep apnea, and we just go based off of that history. Other times we will order a sleep study for children if they're extremely young and we're unsure of their diagnosis. The other reason we take out tonsils is due to infections. We have pretty strict criteria about how many infections you have to have a year to have your tonsils taken out. So our criteria are 7 infections in 1 year, or 5 infections a year for 2 years in a row, or 3 infections a year for 3 years in a row. But we do take into consideration other signs and symptoms of tonsil problems. So if you've had a tonsil infection with persistent swelling of the tonsils or pain of the tonsils that has lasted for over 3 months, we usually consider that a chronic condition, and that would be a reason to consider taking out your tonsils at that time. Other things, sometimes people get little tonsil stones stuck in their tonsils, which are literally like these little white, yellow pebbles that will come out of their tonsils. Sometimes it can cause bad breath. It can definitely cause irritation back there. Those are reasons that we would take out your tonsils. Other times, sometimes they're very large and they actually interfere with your swallowing. Or you could get an abscess called a paratonsillar abscess from a throat infection. Those would all be other reasons that we would consider taking out your tonsils. Surgery itself is actually pretty fast. I always tell my patients plan on about an hour, but honestly the surgery itself takes about a half hour. But you do have to go back to the operating room, go to sleep, get all the monitors put on. So usually you're away from your family for about an hour. I prefer using a machine called a coblator to take out your tonsils. It actually uses plasma. There's been lots of studies about different techniques to take out the tonsils and whether or not there's a decreased risk in the post-op tonsil bleed or a decreased amount of pain after surgery. And really currently there's not a lot of studies out there supporting one method versus the other. So you definitely want your surgeon to use a method that they're most comfortable with. Most tonsillectomy procedures are actually outpatient, which means you do come in that morning, you get to go home that day. If you are very young, such as less than 3 years old, and have a diagnosis of sleep apnea, we do recommend that you stay overnight if you are less than 3, or if you've had a sleep study in your child and your sleep study showed a very high score for sleep apnea. Those would be reasons that we would keep you overnight. Otherwise, the majority of people do get to go home afterwards. So what to expect with tonsil surgery? I'm not going to lie to you, it's pretty painful. Probably one of the most painful surgeries that we do in ENT. So after surgery, you have about 2 weeks of not feeling very good. We are definitely there for you, support. We will give you something to take for the pain. It's very important that you stay hydrated after surgery. You may not feel like eating a bunch after surgery, and that's fine. Once you heal up, your diet should go back to normal. Other things to expect, it definitely looks abnormal in your mouth after surgery. Where I take your tonsils out, you're going to get these scabs that form, but the scabs are going to constantly be wet. So sometimes they're this yellowy green, grayish color, and it can smell really bad. And that's actually what normal healing looks like after surgery, even though it sounds pretty bad. There is a risk of something called a post-op tonsil bleed. It's not very common. It only happens in 3 to 5% of people. But if that does occur, sometimes it will just stop on its own. Other times we do have to take you back to the operating room.